Hello, my name is Keandria Tyder, and today I'm going to demonstrate a 10-minute moment for abdominal pain. The 10-minute moments were created to help assess physical exam skills. They contain a faculty development part and an assessment part for your learner. Assessing and giving feedback on a learner's physical exam skills should be easily integrated into the flow of clinic or inpatient rounds in the hospital. The 10-minute moment is a tool to assess physical exam skills only. It does not include history taking. Let's get started. Our patient today comes into the hospital with a complaint of abdominal pain. Your learner is tasked with performing a physical exam to narrow down the diagnosis. The initial step in evaluating a patient with abdominal pain begins with inspection of the abdomen. It is very important to make sure the patient is lying supine with the patient's head and neck supported by a pillow if possible. It is also important to make sure that the abdomen is completely exposed in order to do a thorough inspection exam. While inspecting the abdomen, learners should ask themselves the following questions. Are there any scars from previous surgeries? Any skin changes that can be noted? Is there an asymmetric distension of the abdomen? For example, gross enlargement of the spleen, the liver, ovaries, or hernia? Are there any venous patterns consistent with liver disease? For example, caput medusa. Is there an ostomy present with an ostomy bag? If so, how would you describe the surrounding area of the ostomy and the contents within the bag? Any signs of ecchymosis that may be consistent with the intraperitoneal or retroperitoneal hemorrhage? Any evidence of active peristalsis visible on inspection? Any abnormalities related to the shape of the abdomen or the umbilicus? Once again, an abdominal wall hernia or umbilical hernia. Learners should also take note of the patient's general appearance and vital signs. Does the patient appear toxic? Is the patient diaphoretic? Do they have rigors? Does the patient appear in pain? Are the vital signs abnormal? The inspection portion of the abdominal exam also includes evaluation of scleroicterus and overall jaundice of the skin. I will now demonstrate how to examine and evaluate for scleroicterus. You will need a pen light for this exam. And I'm simply going to ask the patient if she would mind if I opened up her eyes just briefly so that I can take a very detailed look of her conjunctiva. Okay. Now I'm going to shine the light directly into her eye, and I'm going to evaluate both eyes. And I do not see any yellowing. Important clinical pearls to point out to your learner includes looking for visible peristalsis on inspection. Though rare, this can increase the likelihood of a small bowel obstruction, and this exam finding has a likelihood ratio of 18.8. Also, noticeable abdominal distension significantly increases the likelihood of a small bowel obstruction and has a likelihood ratio of 9.6. After proper inspection of the abdomen, learners should begin auscultating the abdomen. Learners are often taught to listen in all four quadrants of the abdomen. However, this is not always necessary. It is important to teach learners that normal bowel sounds modestly decrease the likelihood of a small bowel obstruction, and normal bowel sounds vary greatly from moment to moment, particularly as it relates to oral intake. I will now demonstrate auscultation of the abdomen. I will briefly listen in 2 to 3 areas of the abdomen, and I'm hearing normal bowel sounds. As noted during the inspection portion of the exam, visible peristalsis and abdominal distension are helpful exam findings that increase the likelihood of a small bowel obstruction. Auscultation of the abdomen may reveal hyperactive bowel sounds and can also increase the likelihood of a small bowel obstruction and has a likelihood ratio of 5. Let's move into the next step of the abdominal exam to evaluate abdominal pain, which includes palpation of the abdomen. Learners are taught to start with a light palpation of the abdomen using a one-handed technique. Then advance to a deep palpation using a two-handed technique. I often teach learners to start opposite of the location of the patient's primary region of abdominal pain, as to avoid immediate guarding that can inhibit proper assessment of the rest of the abdomen. It is important to make sure the learner palpates in all 4 quadrants of the abdomen. Learners should look at the patient's face to evaluate for signs of tenderness to palpation rather than directly at the abdominal region they are palpating. Palpation of the abdomen may include specific physical exam maneuvers to further differentiate a learner's working diagnosis. We will demonstrate some of the common abdominal exam maneuvers at this time. There are a variety of exams that, if positive, can increase the likelihood of appendicitis. These exams include palpation of McBurney's point, Rovsing sign, and the psoas sign. McBurney's point can be found approximately 1.5 to 2 inches from the anterior superior process of the ilium in a straight line directed towards the umbilicus, like so. This exam maneuver has a likelihood ratio of 3.4 if positive for tenderness to palpation in this location. A positive Rovsing sign can be described as tenderness in the right lower quadrant during palpation of the left lower quadrant. This occurs when the peritoneum rubs against the irritated appendix and causes pain in the right lower quadrant. If the patient has pain in the right lower quadrant, this is considered a positive test and has a likelihood ratio of 2.3. To perform the psoas sign, trainees must ask the patient to roll onto the left side and extend the right leg backwards. Would you mind rolling over to your left side? Thank you so much. And I'm going to ask you to straighten this leg, and I'm going to ask you to extend it backwards. Excellent. Now, I want you to press against my hands as you bring the leg forward. Thank you so much. Another way to perform this exam is to have the patient lay flat on their back and ask them to lift their leg up from the hip joint. Please lift your leg up and push against my hand, applying pressure just above the knee. Thank you. If a patient has pain during either one of these maneuvers, that is considered a positive test and sign that tension of the psoas muscle is causing irritation of the appendix, and this positive exam has a likelihood ratio of 2.0. Palpation of the abdomen can also be used to evaluate for cholecystitis. Learners are often familiar with the classic Murphy sign, but struggle with proper technique and interpretation of this exam maneuver. Learners should be instructed to press firmly over the gallbladder, which is often in the area where the edge of the rectus abdominis muscle meets the costal margin. Once the learner's hand is firmly placed in that region, learners should ask the patient to inhale deeply. Please take a deep breath. Thank you. And exhale. Thank you. If the patient has cessation of inspiration due to pain at the point of palpation, this is considered a positive Murphy sign and has a likelihood ratio of 3.2. It is important to remind learners to be sure to watch the patient's face and monitor for cessation of inspiration as they perform this exam maneuver. Palpation of the abdomen also includes evaluation of the abdominal wall. Assessing for abdominal wall tenderness includes evaluating for Carnet's sign. This specific exam maneuver is helpful if a patient has localized pain in the abdomen, typically to the right or the left of the abdominal rectus muscles. Learners can be instructed to locate the area of maximal tenderness to palpation and apply modest pressure. While applying pressure, learners should ask the patient to lift their shoulders and head off the bed. Would you mind lifting your shoulders and head off the bed? Excellent, thank you. If the pain is the same or worse in the area of palpation, this is considered a positive test. An important part of the learner assessment is to comment on the learner's attention to the patient's comfort and well-being. Did the learner make sure that the patient was comfortable? Did the learner explain the different maneuvers to the patient? So this concludes the assessment of the exam for abdominal pain. Thank you.